Hi, my name's Lissy and I'm a pelvic health physio at Physio One Taringa. For Women's Health Awareness Week, we're going to have a quick chat about sexual pain, how it interacts with the pelvic floor, and a couple of ways in which physiotherapists and other health professionals can help facilitate this healing process for you. Now, there can be a bunch of reasons which might be causing your painful intercourse. Often what we refer to at a pelvic health physio session is we want to have a look at obviously your past experiences, because we know that when we've had a negative experience or trauma or a painful encounter, at the end of the day, next time we go into that situation, our muscles at the pelvic floor are going to be holding a lot more tension and stress, and we're going to be feeling a lot more fearful about going into that situation, which automatically increases our stress hormones and causes everything to tighten a lot more, which ultimately will increase our pain. So a good place to start is first of all chatting to your GP. Now they might decide to refer you directly to a pelvic health physio or to your gynecologist. What a pelvic health physio is going to do is we are going to have a look on a vaginal examination. We want to have a look at what the muscles are doing. So we're going to assess the superficial layer and then that deeper layer of your pelvic floor to check out if the muscle tone or the muscle activity is sitting a little bit higher than we'd like it to be. And if that is the case, that pelvic floor musculature is holding a lot more tension or it's feeling like things are quite overactive in that region, we want to start off by teaching you firstly how to breathe and control the pelvic floor muscles correctly. Now, ultimately, it's a lot easier said than done to say, okay, we're just going to squeeze those muscles and then we're going to completely let go of them. So we would go through and we would actually teach you how to down train and control that lengthening ability and relaxation of the muscles. Ultimately, there is a number of reasons why patients experience sexual pain, and generally one assessment is not going to allow us to unravel all of those components. But what a pelvic floor assessment could start with is ruling in or out how much of it is related to the muscular and nervous system. It's also worthwhile chatting to your gynecologist and your GP if you're noticing any hormonal changes. Obviously structural and mechanical pressures from prolapse and things like that can also cause painful intercourse. But at the end of the day, chatting to your health professionals is the most important place to start. So to finish off with, let's have a look and see if we can teach you how to contract and then most importantly, relax the pelvic floor muscles. So if you can imagine the pelvic floor sitting from the front of our pubic bone and wrapping around to the base of that tailbone. So it's kind of sitting like a hammock support system. Now, if you're sitting on a chair, find a nice flat surface so you're getting that feedback along the tailbone and the pelvic region from the surface of the chair. If you want to place a hand or both your hands on your rib cage, let's just think about taking a nice big breath in. As you're breathing out, I want you to think about tightening around the back passage and just gently squeezing up away from the surface of that chair. And now as you're breathing in, let's see how well we can let go of those muscles and start to relax them. So we're going to be breathing in, letting go of the muscles, softening them against the back of the chair. And then as you're breathing out, we're going to tighten that back passage. So we're getting that feedback from the chair to notice what a contract versus relaxation exercise is like. So this is a really good exercise to start with because a lot of it is actually learning how to connect the mind to the pelvic floor and getting those muscles to work how we want them to. But it does take time to train the muscles. So try to work towards building in even just daily pelvic floor exercises where you're contracting, but then most importantly, letting go to create that really good movement and mobility in the muscles. Feel free to reach out on social media or via email or to our clinic if you have any questions or you'd like to chat further about how we might be able to help you with your sexual pain.